Assalamualaikum warahmatullahi wabarakatuh. My name is Reynaldy Anggara Saputra. I'm from the S1 Nursing Study Program C. In this video, I will describe about tuberculosis disease. Diseases are certain abnormal conditions that negatively affect the structure or function of part or all of the body of a living being and are not the result of any external injury. Diseases are also known as medical conditions that are associated with certain clinical signs and symptoms. As I said earlier, here I will discuss tuberculosis. TB or tuberculosis, also known as TB, is a lung disease caused by the bacteria Mycobacteria tuberculosis. TBC will be cause a symptom in the form of a cough that lasts a long time or more than 3 weeks, usually with plague and sometimes bleeding. TBC can not only that attack the lungs but can also death the bones, intestines or glands. This disease is transmitted from the saliva that comes out of a TBC sufferer, then talking, knocking or sneezing. This disease is more susceptible to infection in someone with low immunity, for example people with HIV. There are two types or gets or TB. That's TB. This is the instinctive form of the disease because the body immune system can flexibly TB bacteria. People with latent TB will have no explain as long as the disease is not active. Latently TB is not contagious. Active TB. Active TB occurs when bacteria begin to win the fight against the body defense system and start causing symptoms. When bacteria inside the lungs, active TB and easily spread to other people. TB can also be influenced based on the location of the infection site. 1. Primary TB. This is when bacteria are found in the lungs. That means that there is a danger of passing of disease on the other people every time the affected person actually coughs and lung. 2. Pulmonary TB. If the bacteria grow only in other parts of the body and not in the lungs, the disease will not spread as easily as the case of the lungs. Cause of tuberculosis. The cause of tuberculosis is bacteria that are spread in the air trunks, the saliva from coughing or sneezing with TB. The name of the TB bacteria is Mycobacterium tuberculosis. Here are some group of people who have a higher risk of contracting TB. 1. People whose immune system has decreased, for example, people with diabetes, people on steroid chemotherapy, cars, or people with HIV/AIDS. 2. People who are diabetes of normal risk. 3. Drug addict. 4. Smokes. 5. Medical officer who often come in contact with people TB. Symptom of tuberculosis. Tuberculosis general attack the lungs with a main symptom of a cough with problem that lasts more than 2 weeks. The cough that occurs also sometimes produces rice chlorus, plasm, or pulse of bulb. People with TB also usually lose their appetite and experience weight loss accompanied by fever, neck sweat, and fatigue. If the tuberculosis infection of the lungs has caused damage to the lungs, symptoms of shortness of breath will develop. TB bacteria might be interactive when they enter the body, but over time eventually cause TB symptoms to appear. In the case, the condition is known as latent tuberculosis. Meanwhile, TB that immediately circulating symptom is known as active tuberculosis. Tuberculosis treatment. TB be detected through symptom examination. Some other tests then can be done to detect this infection disease are chest X-ray, blood test, or skin test. Meningus. TB can be cured if the sufferer adheres to taking the medications according to the doctor prescription. To overcome this disease, sufferers need to take several tests or medications for a long time, or at least 6 months. The drug is generally in the form of isoniazid, rifampicin, cazylinamide, estambutal. As the types of therapy used for the treatment of tuberculosis. Therapy for active TB consists of 1. Combination treatment. The use of a variety of drugs to ensure that bacteria do not become resistant to the antibiotic being consumed. Then, this therapy usually involves 4 kinds of antibacterial drugs and are taken consistently for 2 months to 4 months. 2. Direct observed therapy or DOT. In the case of DOT, patients are closely monitored by attending doctor whenever they take medication. B. Latent TB therapies are 1. Antibiotics. People with latent TB need only one dose of antibiotic at a time. Antibiotics there are usually prescribed include isoniazid 6 until 9 months and rifampicin 4 months. Combination therapy for latent TB. At most 2 types of drugs can be taken at the same time. Triggered supervision medications may also be used. Tuberculosis prevention. TB can be prevented by giving the vaccine, which is recommended before the baby is 2 months old. In addition, prevention can also be done by 1. Wear a mask when it's in a crowded place. 2. Cover your mouth when your signs, cough, and lump. 3. Do not spit or speak carelessly. So, my experience about tuberculosis. Apologize if there are deficiencies or mistakes in making this video. Thanks for your kind attention. Wassalamualaikum warahmatullahi wabarakatuh. Thanks.